Multiderm is a great treatment. It's a procedure that we do several times a day, and I think the reason that it's been so well accepted by our patients is there's no downtime, you get a great result, the result is immediate, it's relatively inexpensive, and for us it's something that we can use as an adjunct to almost any treatment that the patient has on. And it doesn't matter whether the patient's coming in for acne vulgaris, if the patient is coming in for melasma, if the patient is coming in for facial rhytids. I mean, it's a procedure that can be used across the boards. Patients with rosacea do fine with it. It's quick, it's simple, it's easy, and it feels great. Unlike traditional microdermabrasion, which is kind of uncomfortable. I mean, I think most patients describe it as, you know, a cat licking your face. You end up with salt crystals all over the floor. It's kind of messy. The Multiderm is neat, and you see a result right away. I mean, when the patient is done with their 20 to 30 minute procedure, however long it may be, they can feel their skin and they see and feel a significant improvement. And that basically sells the patient. I mean, you can tell someone, you know what, do one treatment and see how you like it. And if you love it, then sign up for the package. And typically most patients we have that do one treatment, they'll sign up for a series of 6. And that's typically how we do it. We do one treatment per week for a series of 6. And patients get a great result with it. The nice part about it too is, unlike traditional microdermabrasion, you can do multiple areas. You can do the back, you can do the arms. It's great for patients with keratosis pilaris. It's great for patients with keratoderma on the soles. I mean, there's just an infinite number of conditions that you can use it for. And I think as time goes on, we're going to see it really taking off as far as pre-treatments for other procedures, for patients undergoing IPL or even CO2 laser, different other laser-based procedures. To be able to remove the entire stratum corneum before a procedure gives a great benefit. No matter what procedure you do after that, you're going to get a great result because you've got a nice base to start with. The other benefit too is that we use it in patients who are undergoing Botox or even hyaluronic acid, Restylane, or Juvederm treatments for topical anesthesia. You can use the Multiderm first and then infuse with a little EMLA, get a nice numbing effect, and basically the procedure is painless. But there's just a multitude of uses for this procedure, and like I said, as time goes on, I think we're going to find even more and more uses for it.